Hello. Braces today have become a symbol of modern day living. They are accepted across the entire socio-economic spectrum of this country. A lot many children now opt for braces, and their parents look forward to a beautiful smile with straight teeth in their children's mouth. What is interesting to note, and this is going to be very exciting for you to know, that the treatment with braces is a more than 100-year-old specialty of dentistry. It started as a specialty in the year 1900 in Chicago in the United States, and since then it has grown and flourished all over the world. A lot many dental students aspire to be able to take this particular course to treat patients with braces. Dentistry offers two degrees. One is the Bachelor of Dental Surgery, known as the BDS, where it's a generalized course with all the courses in dentistry being taught. And the other is the MDS, where you have the master's course or the Master of Dental Surgery course, which then helps you to specialize in one particular subject. The treatment with braces is generally offered to the public through a specialty structure and is offered by a specialist called an orthodontist. Now, every MDS is not an orthodontist, you must remember that. Because whenever somebody says he's an MDS, the most important question to be put up to the gentleman or lady is that MDS in which subject? That is a question that you need to ask in your own interest. A lot many people enter into this treatment procedure with very little knowledge of what's really going to happen. Most times, what is conducted in the form of a consultation is a very quick diagnosis wherein it's just decided on the spot within 5 minutes as to what's to be done. It's in your interest to know as to what you are going to get from this entire treatment procedure, which is, to say the least, expensive and time consuming and involves your participation to the fullest, because there's a lot of home care involved with the treatment procedure and you have to present yourself regularly for the treatment to be conducted in the proper manner. Whenever you have a problem in the teeth, the first thing you do is go and visit the dentist, because most people do not know where to go, and that's fair enough. The dentist then refers the patient for braces to somebody or offers the treatment in his own office, as somebody may be visiting that practice and the treatment is therefore offered over there. Now, this is quite a long-standing arrangement. When I started my practice way back in 1975, I also did a lot of visiting practice. That time there were very few orthodontists in the country, but today there are lots and lots of orthodontists all around. So it was not going to be difficult for you to locate a orthodontist very near to you or in your locality, because visiting practice has its own limitations wherein all the equipment is difficult to carry by the orthodontist to each and every dental clinic that he visits. At this stage, to establish an authenticity of what I'm telling you, I'd like to introduce myself. I am Dr. Jayanth. I'm an orthodontist and I am in specialist practice as an orthodontist since the year 1975 in the beautiful city of Ahmedabad. And what I need to tell you is because right now I'm locked down. I'm in the phase of lockdown and I'm utilizing this time to be of service to those who wish to know more and deep knowledge of what you really get or expect so far as orthodontics is concerned. At the very onset, what you need to understand is that a orthodontic treatment is a evidence-based treatment procedure. We are able to demonstrate exactly what we have done. So therefore, it is important that pre-treatment records are established or taken. Amongst the first record which is established is a model. A model is a plaster cast of an impression which is made in the mouth. You will see this behind me. And this is used as a record of where we started, and is also used in diagnosis. In addition to this, we need to have an X-ray of the mouth. Today's technology helps us take an X-ray which portrays a panoramic view of the entire mouth, including your temporomandibular joints. So this helps us establish what is the status of the teeth, or if any teeth are locked into the bone and have failed to come up into the mouth. This is an important record to take. The second X-ray which is taken is called a lateral cephalogram. It is an important X-ray. Here in this particular X-ray, there are actually 5 entities. You need to understand that. The head, or the cephalo as you call it, the cephalogram is a measurement of it gives you cephalometry, which is a measurement of all your landmarks in the head. The first one is your skull itself, which is going to be standard. There's no way you can make any changes to that. Therefore, we call it as a standard reference point. After which there are 4 more entities. There is the upper jaw. Then after that is number 1. Then there is the upper set of teeth. That is the entity number 2. And there is the lower set of teeth, entity number 3. And then last but not the least, the lower jaw, which is entity number 4. This cephalogram helps us establish which of these 4, in relation to each other and in relation to the standard landmark of the skull itself, is out of line, or where we try to localize where the fault really lies, and accordingly a treatment plan is worked out. Now, in addition to this, what is taken is a set of photographs. The photographs are face front, then you have face as how it looks from the side, because the profile tells a lot. You will see this in your normal life also. What you see in front like this would be quite different from what you could see from the side. So we take a profile, then the teeth in position when they are close together in the normal setting, the teeth, open mouth, upper teeth and the lower teeth, then the teeth how they lock on the left hand side and how they lock on the right hand side. This is a important pre-treatment record, and is in most practices it is taken up as a record. This printed out, laminated and handed over to the patient, because it's better the patient keeps it, because like I said, it is all evidence based. At the end of the treatment, a similar record is taken, and the two then are compared to know exactly where we have landed at the end of an expensive and prolonged treatment. Now, the beautiful part of orthodontic treatment is that a patient with the pre-treatment record in his hand can actually stand in front of a mirror and try to compare to see where his present status of teeth is. You may not be able to see everything, but you will be able to see a general outline of what's happening. And it's not like having a heart problem where you don't know what's happening to your heart. You only see lines on a cardiogram, which is difficult for even a regular doctor to decipher. Well, and what is more is important in all this is that you get the confidence of the treatment moving forward. Because if you have spent an X amount of time with the doctor concerned in his clinic and he says he's done a lot of work on your teeth, then the result must show, and that's where it shows. In addition to this, what is very important to understand is that there is something called a treatment plan. In the diagnosis, after all this is available to the doctor concerned, what is laid out is a treatment plan which you must retain with yourself. Because a number of times it may be that you will decide to know, you were told probably that you don't need to have any teeth taken out for the course of treatment, and then suddenly you have to face a situation where it says, no, you need to take teeth out, otherwise nothing's going to move in your mouth. Now that is a little embarrassing situation all around. Nobody likes it. Neither the doctor would like it, neither the patient nor the parent. Because whenever you're faced with an extraction, the first thing that comes to mind is that the pain associated with it. And maybe you would not have started the treatment if you had been told in the beginning that a teeth need to be taken out. Well, but the record definitely helps establish on the part of the orthodontist as to what he has really done. Have been instances wherein the patient comes up and says, "Oh, I don't know how much has been done," because after the treatment, there are patients who actually forget what they look like in the beginning of the treatment. And it is a pre-treatment record which helps us to establish, look, brother, I brought you from here to this point. And therefore, it's important that this record be kept and maintained. At the end of the treatment, what is given to a patient is a set of retainers. The retainers are a very important aspect of the treatment, and they're a part of the treatment, mind you. The retention protocol of how it's going to be retained is established right at the time of the diagnosis which is made, because that's when you know what you're really correcting. If you're going to be correcting things, then you must know how you're going to retain it also. So that's how it happens, and therefore the diagnosis is a very important entity of the entire procedure of the orthodontic treatment. Now, what I need to tell you further is that what do we look in a properly finished case? When a case is finished, there should be no spaces left in between. Sometimes it is required that teeth are taken out to make space for the corrections to be made. Now, if teeth have been taken out, it's important that the spaces be closed, because there is no other way that they can be left there. Also, what's need to happen is that when we finish a case, we need to see what is the level of the front lower teeth, or for that matter, the upper lower teeth. Sometimes the teeth have erupted out further, and this photograph will explain to you, the bite therefore has to be leveled. We can't just say that, oh, things are just fine. The teeth which are up in front, normally there are situations where the lower front teeth erupt more than the back teeth. Now, it is a part of the treatment to see that the whole thing is leveled off beautifully, and they all have to be in one level. That is generally overlooked because we don't go and check into that aspect of things. With these little presentation, I have brought to you certain points that you need to see. I might have missed out a few, but records, and you maintain the records. You keep the records with yourself to know as to where you are reaching the treatment. Okay. I hope I have been able to make my point with this small presentation. And if you have liked my presentation, kindly subscribe to this section so that you are able to visit more of the videos that I make a presentation on in the times to come. With that, I'll say goodbye, hoping to see you in my next presentation. Thank you very much.